Donnie Springer. I'm a registered respiratory therapist for Protect Medical in Columbia, Tennessee. And today I want to tell you a little bit about taking your medication for breathing at home. Typically what you'll get is a little compressor. It's nothing more than an air compressor like you might blow up a tire with. It has an on-off button. There's no settings for adjusting the amount of flow that comes out. Usually it's about 10 liters a minute. And you'll get a breathing circuit with it, and it's going to have a long hose you're going to attach to the little outlet right there. The air is going to go through here and travel up into the medication cup. Now this is where you put your medicine. There's two ways you can put your medicine in. You can either take the T-piece and the mouthpiece off, pour it right down in the chimney, or you can unscrew it and pour it into the top and then replace it like that. Usually the amount of medication is going to be either 3 milliliters to 5 milliliters, depending on if you're taking one drug or two. It'll take 10 to 15 minutes to take a treatment, and the way to take your treatment is to take in a slow, deep breath, hold the breath a minute because you want that medicine to settle out on your lungs. Medication is about 1 micron to 5 microns. If you're taking medication with an ultrasonic nebulizer, it's going to be a lot finer mist. So you might have to hold your breath just a little more. Otherwise, you take a deep breath in, you blow it right back out. It's important to take a real deep breath because all this plumbing up here, the upper airway, is just what we call dead space. It doesn't exchange with the blood, and it doesn't help your lungs. So you got to take a good deep breath. So take one deep breath, hold it for 2 or 3 seconds, blow it out, breathe a couple normal times so you don't hyperventilate and get dizzy. And just keep doing that over and over until you complete your treatment. Some circuits will have this corrugated tubing on. That's 50 milliliters, 6 inches of corrugated tubing. And the purpose of that is so that it's going to fill up with medication, so when you take a breath, this won't be lost to the room air. All this that's pouring out the end will be lost. If you're giving treatments to one of your kids that is not cooperative and won't take a treatment by putting it in their mouth, you can put your thumb over the mouthpiece and let all the medicine pour out through the corrugated tubing. Just hold it up to their face. They may cry a little bit, but when they take a big deep breath to holler, they're going to get a real good dose of medicine. Other than that, to clean it, you want to just disassemble all the parts. This little cone in this one has a little tiny hole. The air comes out there, sprays up through there, and hits this baffle and makes the medicine into real fine particles. So that little hole is usually the biggest problem with nebulizer circuits. When something goes wrong, it's usually not the pump, it's usually that little tiny hole, so you got to be sure to keep it clean. Just soak it in warm, soapy dishwashing detergent, something mild, rinse it out real good, leave them all apart, lay them out on a towel, let them air dry, maybe once a week or every other week. Some people like to drop them in a little bit of vinegar, maybe 25% solution of vinegar to regular water, and that's a germicide. That'll kill all the germs and bacteria that might grow in them, which is really important. Basically, that's the most common nebulizer circuit. That's the way most of the pumps look. The pump does have a filter on there. Change it, check it and change it maybe about every month, and depends on how often you use it. And that'll keep your pump going for several years.